Hi, I'm Dr. Eric Cedor, Physioformed. What does an acute case of TMD look like? Many times patients present to physical therapy, come to see us now knowing that we specialize in jaw dysfunction in a scenario like this. Had a patient that approximately 1 year ago was having some significant orthodontic work done. She herself is an adolescent, 17-year-old singer, actually talented opera singer. Reports that she had difficulties creating a wide opening of her mouth prior to the dental procedure, but after the procedure, having been held open for a long time, noticed she began to feel pain on the left side of her jaw. Over the next few days, she felt that things were inflamed. Mom thought, hey, let's give this some time, see if it gets better. She was actually at a singing competition about a month later, was hitting a high note, wide open, felt a big pop on the left side of her jaw, and her jaw got stuck. After that, she had a lot of inflammation. Really noticed that she had a few days where she had some difficulty opening wider, and same kind of thing, mom, ice, ibuprofen, that type of thing. She actually called the dentist. He wasn't exactly sure what to do. So time passes. About a year later, things have still not resolved. She's having significant pain. It's affecting her ability to sing, and she sees a buddy of mine who's a pediatric dentist, and he refers her over to see me. So we start through the evaluation process. She had significant tenderness and guarding throughout her masseter, limitations of opening, limitations of translation in the jaw. And so what we began to do was work on loosening all this up, joint mobilizations and translatory glides, things to restore mobility. We're 6 sessions in now. She's actually currently a patient, and she's about 90% better. Now, this has been going on for a year, and it was a situation where maybe had we seen her earlier on, this wouldn't have progressed to this degree. But oftentimes, my experience has been that our colleagues in the dental profession don't exactly know what to do with these patients. They either refer them to a maxillofacial surgeon who recommends a significant procedure. This case in point, this patient was actually called a maxillofacial surgeon, the mom did, who recommended a surgical procedure, said physical therapy doesn't even work, doesn't do anything for this. And we find that there's a knowledge gap sometimes. And so I just think there's a lot of referrals out there that we're missing because our colleagues don't understand exactly what we do. So one of the big pieces of our TMD course is going over the common shared language to help us talk to our colleagues in the dental field and educate them on how we can impact their patients in a positive way. And as we know from experience, the earlier you see somebody in an injury process, the much better the prognosis and the easier the treatment is. So if you'd like to learn more and come take one of our courses, our next one's going to be at Belmont University in Nashville, Tennessee. Click on the sign up button below, and hope to see you there. I'm Dr. Eric Cedor.